My name's Skylar. I'm the student nurse practitioner that'll be taking care of you today. Can you tell me your first and last name and your birthday?
Dylan Kinion, 11/13/1998.
Perfect. Are you comfortable?
Yes.
Okay, awesome. This should only take about 10 to 15 minutes. What brings you in today?
A wellness check.
Perfect. Are you having any pain, discomfort, or shortness of breath?
No.
No? Okay, perfect. How do you feel overall?
Well,
Well, okay, good. Or do you have any concerns at this time?
no.
Perfect. Are you taking any medications currently?
Not currently.
All right, no over-the-counter medications, herbal medications, nothing like that?
Pre-workout and protein supplements.
Perfect, perfect. Any allergies?
Your everyday allergies and
Augmentin, what's your reaction to Augmentin?
hives.
Okay, hives, okay. And any food allergies?
Not that I know of.
Okay, so those are your only allergies that you have.
Yes.
Okay, tell me a little bit about your past medical history.
I was diagnosed with anxiety, depression, had acid reflux, and high blood pressure.
Okay, do you still currently have high blood pressure?
Not that I know of.
All right, do you currently have any medical issues?
Not that I know of.
Okay, perfect. Any significant illnesses that you've had in the past?
No.
Okay, perfect. Are your immunizations up to date?
As far as I know.
Okay, perfect. So you've had the shingles, pneumonia, flu, COVID, all those vaccines?
As far as I know.
Okay, perfect. Any surgical history?
My dental surgery for my wisdom teeth.
And when was that?
High school.
In high school? What year do you think that was?
2015, 2016.
Okay, all right. Any recent hospitalizations?
No.
Okay. Any recent trauma?
No.
Perfect. And then can you tell me a little bit about your family medical history? Is your mom still alive?
Yes.
Okay. And then does she have any like cardiovascular history, diabetes, autoimmune disorders, or cancer?
Stage 4 lymphoma cancer. She is remitted 22 years.
Okay, all right. What about your dad?
He has type 2 diabetes.
Type 2 diabetes. Okay. And then your grandmother and your grandfather?
As far as I know, they have diabetes too, but I am unsure. I don't ask that far back.
Okay, are they all alive?
I have two grandmas and grandpas still alive.
Okay, what did your grandpa that passed away die from?
Stroke or heart attack.
Okay. Do you have any siblings?
And 3 siblings.
Do you know their medical history?
I have no clue.
Okay. And then do you have any children?
I have 1 child.
Okay. Boy or girl?
Boy.
Okay. Does he have any medical history?
Not that I've seen so far. My wife usually handles that.
Okay.
She's a nurse.
All right. So you're married.
Yes.
So you're married. Okay. Do you have family that live in the area?
Yes. All of my family lives in the area.
Perfect. What do you do for work?
Restoration, mitigation, clean out the water and stuff in the basements and clean up all the stuff and tear it all out.
Okay. How many hours is that usually for you?
Give or take 40 hours in a week.
And what does your typical work day look like? Are you physically straining yourself a lot?
I did some heavy lifting, depends on the job.
Are you exposed to any toxins?
Depends on what you mean by toxins. Sometimes we have to clean up black mold.
Okay, so yes. Do you wear protective gear?
Yes.
Okay, perfect. At your home, where do you live?
Akron.
And what kind of house do you live in?
A residential house.
Like a single family home?
Yeah.
Okay, do you have stairs?
Yes.
Okay, and pets?
Yes, 3
3 what?
dogs.
Okay, 3 dogs. Okay. Have you recently gone out of the country?
No, not recently.
Okay, have you ever gone out of the country?
I went to Cancun, Mexico in 2015, 2016 time period.
Okay, any exposure to any diseases?
No, I avoided the water. That's what I was told to do.
Okay, perfect. What about your sexual history? Are you sexually active?
Yes.
With males or females?
Females.
Okay, perfect. And explain to me what your diet is like.
1 to 2 meals a day, intermittent fasting throughout the day, and like cheeseburger, lasagna, like a normal meal for dinner.
Okay, so do you eat pretty regularly?
I would say so, but others may not.
Okay, and do you snack often?
Try not to.
Okay, so typically 1 to 2 meals per day.
Yes.
Okay, perfect. Do you have any stress?
Oh, yes, a ton.
All right. And does it affect your daily life?
Wouldn't say necessarily affect, no. Sometimes makes things harder when I think about it, but I don't think it necessarily affects my daily life.
Okay. Is that often, do you think?
Just about every day.
Okay. And how do you sleep at night?
Okay.
Okay. Do you wake up a lot?
2 or 3 times a night I wake up, yes.
Are you using the bathroom?
Most of the time. Sometimes I just wake up and roll over.
Okay. How long does it usually take for you to fall asleep?
I'm usually asleep pretty quick. My wife hates it.
Do you feel that your waking up could be related to your stress?
I wouldn't say so. I usually wake up singing songs, so.
Okay, so that's good. Good. Do you typically do any self-examinations, like
No,
any
not at
testicle
all.
examinations? No, you don't. Okay. Any tobacco use?
Not tobacco, nicotine.
Nicotine? What do you?
Vape.
You vape. Okay. About how many vapes do you do per week?
One a week.
One per week. Okay. And any alcohol intake?
Yes.
Yes. About how much would you say?
A couple beers on the weekend here and there.
Just beers? Any hard liquor?
No.
Okay.
Me
Perfect.
and hard liquor don't agree.
Okay. All right. Any social drug use?
No.
No. Okay, good. And then any violence in your house? Have you ever been abused, hit, or pushed around?
No, I think my wife thinks about it, but she never actually has.
Yeah. Any emotional, physical, or sexual abuse?
Not that I've noticed.
All right. Any thoughts of harming yourself or anyone else?
Not anymore.
Okay. Any more? When was the last time you felt the need to harm someone else or yourself?
4 or 5 years ago.
Okay. All right. Okay. Any fever, chills, headaches, night sweats?
No.
No fatigue?
None nor more than normal.
Okay. General malaise?
I have no
Malaise
idea.
is like overall body aches.
No.
All right. Any weight changes? Weight loss, weight gain?
Weight loss, but I'm trying
Purposeful.
to do that.
Okay, purposeful. Okay. Any mental status changes? So, with this question, have you noticed anything like you being forgetful?
No.
Okay, perfect. We're gonna loop back around to what I asked you in the beginning. Can you tell me your name and your date of birth?
Dylan Kinion, 11/13/1998.
Perfect. And where are you?
On vacation.
Okay. And what year is it?
2025.
Who's the president?
Donald J. Trump.
All right. Okay. Do you have any skin issues? Any hives, itching, rash, lesions?
No.
Okay. Any bruising, blisters?
No.
Okay, perfect. Have you ever had any head injury or concussions?
Not diagnosed by a doctor.
Okay. Just when you were a kid?
Football.
Okay. Okay. Any headaches or dizziness currently?
No.
Okay, perfect. Any lumps, swollen glands, or pain when you move your neck? Okay, perfect. Any drainage, blurry vision, eye pain, itching, redness, anything with your eyes?
No.
Okay, perfect. Any earaches?
Nope.
Hearing loss or
Nope.
ringing in your ears? Okay, perfect. Any discharge
Nope.
coming out of your ears? Okay, perfect. Any changes in your smell?
No.
Anything coming out of your nose? Any nose trauma or nosebleeds?
No.
Okay, perfect. What about your mouth? Do you have any sores in your mouth? Bleeding gums?
No.
No, perfect. Any toothaches?
Nope.
Missing or broken teeth?
Missing teeth from a former surgery. Nothing that is supposed to be in my mouth is missing.
Okay, perfect. Any difficulty swallowing?
No.
Hoarseness?
No.
Change in your taste?
No.
Okay, perfect. Any shortness of breath, coughing, sputum production, or painful breathing?
No.
Okay, perfect. Any chest pain or palpitations?
No.
Any fainting?
Nope.
Swelling in your hands or feet?
Nope.
Okay, perfect. Any abdominal pain?
Nope.
Diarrhea, constipation?
Nope.
Nausea, vomiting?
Nope.
Any acid reflux?
Nope. Not anymore.
Perfect. Good. And you're not on any medications for that?
Not anymore.
Good. Good. That's good. Any incontinence?
Nope.
All right. Any frequency or urgency?
Nope.
Urinating a lot at night?
Only when I drink a lot of water.
Perfect. Any penile pain?
Nope.
Discharge?
Nope.
Prostate enlargement?
Nope.
All right. Any limitation of any of your joints?
Nope.
Any painful or stiff joints?
Only when I'm lifting.
All right. Swollen joints?
Nope.
You said some painful joints when you're lifting. Just is that related to you lifting?
Yes.
Okay, perfect.
Overdoing the weight.
Perfect. Any numbness, tingling, tremors, or seizures?
Nope.
Okay, perfect. How do you feel about your current level of health?
Okay.
Okay.
Better than most.
Okay. All right. Well, that's good. That's what we like to hear. What kind of things do you enjoy in life?
Hunting, fishing, my son, my wife, working out.
All right. So you love to be outdoors. Okay, good. All right. I think that's all we got. So thank you for your time today, and we'll see you next time.